Well, it is a way to look your best after pregnancy that some are calling too extreme. Dr. Stephen Hopping joins us this morning with the growing trend of mommy makeovers. All right, so what is a mommy makeover?
Well, a mommy makeover can be a number of things, but generally it's a trilogy of surgeries that involve big surgeries, abdominoplasty, tummy tucks, liposuction, and often breast lift, sometimes with or without augmentation.
And is this right after the mother gives birth, or how soon after? And is that a lot of procedures to be done all at the same time?
Well, it is a little controversial in this sense. Some people think it is a lot, but again, with today's techniques, it can be done safely, although, again, we're going to talk about this later. It's very important to put yourself in the right hands when you're doing these surgeries, because they are significant, and there are significant complications. But to answer your question, no, it's not for after you have a pregnancy. It's after when you've had your family.
Got you.
And some women are able, like our friend Mr. Thomas, to, with exercise, get their weight down, but some can't, especially if you've had 3 or 4 C-sections. The muscles just aren't there anymore. Even if you exercise, you can't really do it.
Well,
so this is important.
We've got some really dramatic photos that we want to show you, and just so you can see some of the before and afters. This is, I'm assuming, after a couple of kids, and like you were saying, you just can't get the same effects with working out and eating right, and this is part of the mommy makeovers.
Yeah, exactly, and you know, pregnancy, you know, for the beautiful things that it gives a family, is very, very detrimental sometimes to the muscles, to the skin, and all the exercise in the world just can't get you back to where you were before the pregnancy.
So, Dr. Hopping, let's say I've had my children, I am on a great diet regimen and so forth, working out. How much weight do I need to lose before I even contemplate this type of procedure?
Well, again, I think we need to take a cue from Mr. Thomas. You know, there are lots of things we can do before we head for the operating room, and I think these are important. Number one, you want to be in good shape. Right. Number two, you want to tone your muscles with exercise. Number three, you want to get your weight down to, and it's hard to get to your pre-pregnancy's weight, but get it down to where it was, as close to it as you can before you undergo these procedures. This should be the last choice, but it is a choice. It's a lot of choice that American women are making. The studies have shown that the numbers of people doing mommy makeovers these days is significantly up.
But let's say, you know, I've had my first child and I still want to continue to have a family, and I'm working out and I'm eating well, but I'm just not seeing the results I want. And it's hard for a lot of women to live with that and live with those insecurities. Sure. Can they do a mommy makeover before they have finished having their family?
Wait till you finish your family. Okay. That's the best advice. Finish your family, then do it. Because to have an abdominoplasty, go through a pregnancy, again, you're may have to have another abdominoplasty. It doesn't make any sense. Finish your family, then consider a mommy maker after you've done these other things.
Okay, Dr. Hopping, very quickly, advice on picking a doctor, because this is no small task.
There can be, this is actually a combination of cosmetic and reconstructive. Lots of this is reconstructive surgery. So we're tightening muscles. There are hernias that potentially could be involved, so you need to put yourself in the hands of a board-certified surgeon. Check with the board, make sure he is up to date and he's currently licensed. Make sure that when you do this, you're in a facility that is licensed and that the doctor has done a lot of these. Look at the results, ask your medical doctor, ask your friends.
All right, Dr. Stephen Hopping, thank you so much.